Today, I will talk about how to stop coughing and get rid of phlegm. Three main points to be discussed today are causes of the cough. Second is the home remedies for cough. Third is techniques and devices to mobilize secretions if you have a lot of it. To understand how to treat coughing, first of all, we need to know the causes of the cough. There are a lot of reasons why a person can cough. The most common is respiratory infection, either upper or lower respiratory infection, and this is caused by a bacteria or viruses. Viral infection is very common, but the good thing is it only lasts for about several days to about a week or two. Other less common cause of cough is allergy to environmental factor or pollutant. Other causes of coughing are chronic conditions listed on the right-hand side right here, and those conditions are usually diagnosed by doctors via several type of testings, including lung function test or lung imaging. For example, asthma or COPD, for example, other chronic lung diseases such as pulmonary fibrosis, bronchiectasis, and most importantly, if the cough doesn't resolve within a certain time frame, lung cancer is not to be forgotten because it has been increasingly recognized. Before we talk about cough symptom management, I need you to know that coughing is not necessarily a bad thing. Coughing is your body reaction to bad thing in the lung. It helps you to get rid of the phlegm that gets stuck in the lung and causing chest congestion. However, if cough symptoms is very frequent and it happens at nighttime, preventing you to have a good sleep, and it happens during the time that you at work, it can cause social embarrassment and cause a lot of sore throat. Then certainly cough symptom management is very, very important. There are basically four type of treatments for coughing, and this is about symptoms only. Okay, first of all is medications. Second is simple home remedies. Third is hydration, and fourth is to treat underlying causes. Okay, so first of all, talking about home remedies, I'm sure a lot of you are interested in this. There are a few well-known home remedies for coughing. First of all is warm ginger tea or lemon tea. This is helpful for soothing your throat and warm your throat and your lung up a little bit, and that can help to reduce the sensation of coughing and reduce some inflammation. Other way that is less known is inhaling steam. This is more often used in Asian culture, where you have a big bowl of hot water with steam, and you cover yourself with a blanket to inhale the warm steam coming off, and that could help your bronchi to dilate a little bit. But be cautious of doing this because it can cause burn and such. But in a small amount, it may be fairly helpful for cold symptoms also. Other helpful ways are gargling salt water. This is to help you to get rid of the phlegm in the back of your throat, and that phlegm is sometimes very, very irritable, and it can cause you to cough more often. And this is particularly helpful for me, especially in patients who also have postnasal drip. Other thing that I have tried and worked personally is applying a little bit of warm, like for example, tiger balm or menthol oil in your on your chest. Sometimes it can help to warm up your chest, increase the circulation, and in some patients it can help to dilate the airway a little bit, and that can help with the sensation of coughing also. Now, talking about medications, there are several over-the-counter medications that you can buy for cough relief. The two most often medication that you can find are guaifenesin on the left-hand side and dextromethorphan on the right-hand side. You can find different, either separate or combination of those two medications. They are very effective in treating the symptoms of cough. Guaifenesin can help to relieve congestion. It can thin out mucus and help it to be easily expelled out from the lung. It does have the side effect of gastrointestinal discomfort, some dizziness, and allergic reaction, just like any other drugs. Dextromethorphan is also a very effective cough suppression, and it is safe. But you also have to follow the doses. It's recommended in the instruction on the box. Uh, Side effects are dizziness, also nausea, and it can also have the potential of misuse. Other medications that can be used for coughing are sometimes antihistamine can also be fairly helpful, especially in patients who have nasal allergies or postnasal drip. It can help to relieve the reactivity um, in the bronchi and in the nose also. If those medications don't help with your cough, you may need stronger medication from doctor prescription. What about acupressure? Well, there are a few acupressure points of the body that can reduce cough. One of the most commonly used is the point in between the two muscles right here on the left hand side picture. It is also in between the two clavicle bone heads that you can see right here. By applying gentle pressure of this area using your finger, you can reduce the sensation of the cough. However, if you has never done this before, you should be consulted with an acupressure specialist. Next, we are going to talk about chronic productive cough with copious phlegm. So chronic cough means coughing more than 8 weeks, and productive cough means coughing with phlegm. And sometimes phlegm can be a lot, more than several tablespoons a day. When you have any of those two symptoms, it is very important that you should talk to your doctor about it. Once cough persists more than 8 weeks, other less commonly caused that I talked about earlier might be the case. It might not be simple, just viral or bacterial bronchitis anymore. Those symptoms might be of something else that might need to be treated, and imaging also might need to be done. Here are a few cases example. Look on the left-hand side of your picture. This is the CT scan of a patient who had a complete obstruction of her left lung. As you can see, the left lung here is a little bit difficult to see actually, but the left lung here is occupied entirely by a tumor, and she is on the edge of collapsing the entire left lung if it's not intervened in time. And this is a result from a left lung cancer, and she also has chronic cough for several months. Here is another example of someone who has been having productive cough for several months. Um, this patient has a pleural effusion or pleural fluid accumulation on his right lung, as you can see on the picture here. This effusion is caused by a tumor of the pleura, which is the membrane that outside of the lung. Malignancy or cancer are one of the causes of productive cough or dry cough chronically. However, the most common causes of chronic productive cough are actually chronic bronchitis or chronic bronchiectasis. If that's the case, you tend to have um, copious phlegm, more than several tablespoons of phlegm per day, and sometimes it's just very hard to get rid of the phlegm that's stuck deep inside your lung. So when people say they have a lot of phlegm, where does the phlegm exist? So phlegm can stay all the way from the largest respiratory tube, or the trachea in the lung, or it can go down into the bronchi, or the smaller airway, deep down in the lung, or even the alveolar or the breathing sac, tiny little million of breathing sac in the lung. So that's why sometimes it's very hard to get rid of phlegm. Knowing the location of the phlegm, there are several ways you can do to get rid of it. Number one is acting on the breathing tract to help to improve the efficiency of the cough, to shake the phlegm up. Secondly, is to act on the chest wall, to vibrate the chest wall in order for the phlegm to also be loosened and coming up as well. And third is to act on the wall of the bronchi itself. Um, and you can do several things. You can inflate air into the breathing tract, apply some positive pressure so it can dilate up a little bit for the phlegm to be loosened and expelled easier. Other thing that people do is also using some medications to dilute up the phlegm in order for it to be removed. Here's the diaphragm of what I was talking about earlier. So airway clearance had two locations to do. One is the proximal ways, and the other way is the peripheral way. The proximal way you can do cough augmentation or flow acceleration. The peripheral way you act on the peripheral segments of the lung using several breathing technique or positioning. You can also use positive expiratory pressure, applying extra pressure at the end of the exhalation phase, or you can also use the wall oscillatory device, basically a vibration of the chest wall. Here are a few manual techniques. Percussion and vibration. This is used most often in young children or patients who have musculoskeletal weakness. Basically, the therapist use a cupped hand to clap on the patient's back about 2 to 3 times per second for several minutes, either with the patient sitting or laying on the side. And these actions should not cause any pain. In fact, it should be enough to shake off the mucus that deep inside the lung. Um, and it's usually be done by a, respiratory therapist or patient family in condition that they have been trained by the respiratory therapist. Vibration is something also a little bit similar in that they also use their hand in the patient's back or patient's front. They use fine shaking motion on the chest wall during expiration to loosen up the phlegm in order for it to be expelled out. Again, these techniques are done in patients who have neuromuscular weakness, who have very weak cough and cannot mobilize their secretions, or it can also be used for patients who are intellectually impaired or small children who don't know how to cough with instruction. Positioning is also fairly helpful in mobilizing secretions or airway clearance. If the patient has a lot of secretions on one side of the lung, for example, the right side, then you can keep the right side up while doing vibration or percussion of the right chest. Or you can also tip the patient head down about 30 degree or 15 degree in order for the secretion to easily flow out. And again, this should be done by a respiratory therapist or patient family who are already trained by the respiratory therapist. Positioning is quite easy and it takes only about 10-15 minutes a day. However, if patients all have already increased dyspnea, it can also make the dizziness sensation worse. And some patients also have worse nausea with positioning. Other manual techniques that have been proven to be really helpful and have a lot of evidence supporting this are active cycle of breathing techniques. This is done by slow, deep inhalation through the nose with a pause of about 3 seconds at the end of inspiration to bring air behind the secretions in order for it to be expelled out. And then after this slow, deep inhalation, you breathe out by mouth, and then you repeat 5 times of those cycles. Then after that, you do a forced exhalation through the mouth as long as possible. This is also called coughing. Deep inhalation through the nose, breathe out through the mouth. Repeating this step for 5 times in order for the air to get behind the secretions. And then do a forced exhalation through the mouth or a huff cough. Next up, we're going to talk about positive expiratory pressure devices and wall oscillatory devices. The image at the bottom left corner showed a trapped airway by secretions or phlegm. And as you can see, the airway beyond the trapped secretions is collapsed, and thus no air can go into this sac behind it. And in order for the phlegm to be expelled out, it is very important to open that airway up by applying positive pressure at the end of expiration. We call it the recruitment of the alveoli. There are 4 different types of respiratory therapy devices for mucus clearance. One is just wall oscillation device, such as smart vest or aflo vest. Second is mechanical cough assist device. A third are the devices that can provide positive pressure, like I talked about earlier, to recruit the airway. And it also has auxiliating features, such as a cappella choice, aerobica, or PEP bottle. And lastly is intrapulmonary percussionaire devices. So PEP bottle is one of the simplest devices that can create positive pressure inside a patient's lung. As you can see on the left-hand side picture, this is a child that doing the PEP bottle exercise where he blow into a tube and the other end of the tube is in the water. And by blowing bubble inside the water, the pressure can be transmitted into his airway or his lung to shake off the mucus deep down, and then after that it can clear the airway. So basically the patient will blow into the tube for several times until the mucus is loosened up, and then he can cough the mucus out by huffing or coughing several times. These are a few other pictures. There are several other commercial brands available for the PET bottle. Other smaller and simpler oscillation devices are shown in the picture right here. This is the aerobica on the left hand side and then the a cappella on the right hand side. These devices, you can set up the resistance when you blow into the devices, and then at the end of the device there is a vibration valve that can create vibration of the air to go deep inside the lung. So the step to do it is usually instructed carefully in the manual, but basically you will sit up straight, you insert the mouthpiece, and then you inhale deeply through your nose. Then you exhale forcefully through your mouth into the mouthpiece. You can feel the vibrations after you do that. Then you repeat this breathing technique for several times until the mucus is loosened up, and then you perform huffing cough, and then by that you can get the secretion coming up. This is a picture of a child using the oscillation device. The next category is the mechanical cough assist device. These devices are often more costly, but it can stimulate a natural cough by providing positive pressure followed by negative pressure to help clear the secretion. Thank you for your patience. My talk has been lengthy, so I'm going to stop it right here. The bottom line is that most commonly, cough will disappear and resolve in about 1 to 2 weeks. And so, if your cough persists for more than that, and if you have tried all the remedies that I talked about earlier and it still doesn't really help, something else must be going on. And so, doctor is your next best friend, and you should talk to them so that they can find the root cause of that and treat it accordingly. Thank you.